So what is vaginal thrush more specifically? It is the presence and signs and symptoms of inflammation that are caused by a Candida species in the absence of other infective pathogens. That's a very simplified version or description or definition of vaginal thrush. And the literature gives us two classifications. That gives us the uncomplicated and the complicated. Now, in the complicated classification, the interesting thing here to highlight is that vaginal thrush can not only be caused by Candida albicans, but other Candida species can be involved as well. These are some of the very typical clinical symptoms that can be present during thrush infections. Now, there are a broad range of factors that can disrupt the natural balance of that vaginal microbiota. However, we've also found that sometimes there may not be a clear and distinct or even a severe predisposing factor that makes someone more susceptible to vaginal thrush, because healthy women can also develop vaginal thrush quite sporadically as well. However, what we do understand is that there is still a level of disruption of that vaginal environment that promotes the development of vaginal thrush, that there is some reason that this disruption is happening, it's occurring, and often the root cause of that may not be immediately evident. And this is where we as natural therapists will use all of our education and training we employ this approach that is intended to rebalance things. And what we do is we take all of this information to help us devise a treatment program that takes into account all of the presenting symptoms, the signs, and the underlying factors that might be contributing to Candida overgrowth. And that also includes assessing other body systems as well to provide an integrated approach to treatment. What we are trying to do is to bring things back into equilibrium, such as the immune system, for example, and to create the circumstances to put Candida back in the place where it should be. So what we look at is how might each other system in the body be interacting and affecting another, and potentially creating the environment for the development and the proliferation of certain conditions. And so by establishing this, we can also then determine the types of treatments that our patients may require. So keeping in mind that the particular presentation of our patients might actually require or necessitate a range of different therapies and a range of different compounds to provide a broader approach to rebalancing and that restoration of health. Now, as I mentioned earlier, Candida goes through a range of stages to promote infection, and I talked about these 4 points just a little while ago. If someone's defenses are compromised in some way, it will actually start to grow. It'll shapeshift, it'll adhere to vaginal surfaces and potentially create biofilms. And this all leads to this Candida load and the onset of those symptoms. So what I'm showing you here is where different compounds can be used and where they may be applied. Now, this is not comprehensive, it's just a guideline. And as you can see here, Horopito may potentially have a role to play right throughout this process. Now, based on the 2 clinical studies I discussed and the case studies, Horopito is a promising new treatment for Candida and vaginal thrush. It is exciting to see where this research is